Okay, so we have several suggested approaches for the HPV vaccine, and there's probably more than just these, but I think and as we go through these, if one of your favorite approaches is left out, please do tell me, and we'll, submit it as a write-in vote. Okay. So anyway, so these are four approaches: voluntary school-based, girls only; voluntary, girls and boys; mandatory, girls and boys; and then targeting high-risk groups only. So, what do you? Yeah.
How about including like education about the sex in the along with the voluntary approaches?
Oh, I mean, we could include a lot of things. We could include education and screening and stuff like that. But right now, I just want to focus, and we'll talk about that, or you'll talk about that. Right now, I'm assuming that we have all that other stuff in place, okay? And I'm just focusing on the on vaccination, okay? Now, if somebody later on wants to make a plea for just chucking out vaccination altogether and just rely on education, that's fine too. But I'm assuming. Well, let me ask this question. I guess that's fair. I mean, we could just say, okay, somebody wants to vote for no vaccine whatsoever. Okay. So how's that? No vaccine, no vaccination, right? Just throw it out the window. Anybody votes for that? I just want to be fair to all the approaches here. The vaccination is performed in the school.
Not like traditional vaccines where it's required to get in the school or something like that.
It's
The traditional vaccines are community-based, I would think, with the school-based requirements.
Well, I mean, this would be similar to like the measles and all. In order to let's just say that it's not mandatory to well, unless we're dealing with this. If it's mandatory, then we are dealing with, in order to attend school, then you have to get the vaccine. Whereas this is, if it's voluntary, then obviously you could still attend school because it's voluntary, as opposed to some of the other vaccines in which entry into the school is conditioned on getting the vaccine. So this would be opposed to, I don't know, just getting the vaccine outside of school. And we could certainly put that on the list as well if you want to make a plea that just get it out of the school system all along. In fact, we could have that as non-school based.
Just community-based.
Yeah. Okay. Community based.
I'm not sure if there's an ethical distinction or not.
Ethical distinction between what?
But I'm not sure if there is or not. But
between what, school-based and community-based?
yeah.
Okay. So what would be the reason to leave it out of the school system? I mean, I think there might very well be.
Well, I guess you could say there's more autonomy and whatnot if you get it out of the school, so there's more potential for coercion to have it in the school.
Okay, that, well, would it be coercion if entry is not conditioned?
Maybe I'm a little bit confused about the definition. So the school-based means like when you physically present to school, and you go to the nurse's office to get the vaccine there, or are you saying it's a school-based thing where you have to present your certificate and show that you were vaccinated yeah.
Right. Yeah. Well, if it's voluntary, then you don't have to present a certificate.
But it's performed in the school.
It's performed in the school because the thought is that you could get a higher rate of vaccination because the thought is that everybody goes to school. It may not be true, but not everybody goes to whatever community center you want. So you have more of a captive audience, if I could use that word.
Would the parents be involved with whether or not the kid will be vaccinated?
The short answer is yes, except for if we're talking about mandatory. Because then if we're talking about mandatory, then, mandatory, the parents would still be involved because there's always this religious exception. Okay, so the short answer to that is yes, but it would be unless you could show demonstrate a religious exception, your kid would get vaccinated. So right now for the measles and the other vaccinations, in order to gain entry into school, you have to, I don't know, show some kind of have your pediatrician sign off that you got the vaccination, I could see where the confusion is going. I mean, it could be given in the school. It could be checked to see whether you had it or not. But the voluntary would be that one could opt out. One could say, okay, a note from the pediatrician, due to religious reasons or other reasons, we're opting out. So now some people have thoughts about the school-based. Jennifer, do you want to have? And I think.
Well, I'm saying at least if it was community-based, you get the homeschool kids, and in some developing countries, girls don't go to school. You could at least hit that target audience.
Right. So right now we're gonna have a discussion just for developed countries. We'll certainly talk about developing countries, and that's a valid point, Frederick.
I think it was 9 countries.
Yeah. Right. Okay. Yeah. Oh, yeah. No, that's a whole other. Let's sort through. Let's sort through this. Let's develop our concepts, using our own country, and see if it's easier or harder to talk about developing countries. Let's slosh through this first. Yeah, Emily.
One issue with school-based in this country is there are schools with religious affiliations that may have more objections to that. That there's kids that is going to schools with certain religious affiliations, the schools with refuse
Right. I guess they would have their own set of rules and regulations that would be not captured by any state or federal regulations, I mean, I think even religious schools would still, well, I can't even say that. I was going to say they would still offer it to the parents, but they may feel, that's an interesting question, they may feel it's against the religious tenets and don't even want to offer, don't even want to acknowledge it's out there. You want?
I was just going to say, because one of the articles that did talk about, I think, a Catholic organization. I don't think it was necessarily a school. But even though, they prefer to educate people on abstinence, they still see the importance of educating them on having the vaccine.
Okay, all right, well,
So
that's
I think they
interesting.
could probably still,
Yeah,
they may,
about that, and then also came across, I don't know if it was a meeting or elsewhere, a letter from a Catholic priest saying that, it talked about all the ways that this vaccine was just morally wrong and against, his religious beliefs. And that's the Catholic people were to take that place.
Right, yeah, I would have thought that would be more like the party line. Okay, all right. Okay. Yeah, some people might think that it being in the school may confer sort of legitimacy to the vaccine, and one might say that that interferes with, a valid informed consent because of the association of, you associate schools with being good things, I think, and hence it being offered in the school or entry being conditioned on the school may overemphasize the appropriateness of the vaccine. But I think probably the major reason why I'm focusing on the school, because if it's going to be mandatory, the best way to have it mandatory is to have it based on conditioned on entry. Yeah, okay.
Talking about the school, I know that when the school wants to give vaccines to the kids, they give them permission slip to be signed prior to the vaccine. So
right.
I would like to believe that if this has to be school-based, there should be some kind of consent from parents.
Right, I think that's a fair assumption. Right, yeah, Jackie?
Another question is whether communities will need to pay for it. The school will pay for it, or they get subsidized it, or if the parents are going to have to pay for it.
Right, and that's in the mix too. I chose, and that's a good point. That's why I'm having this 10-minute general comment period, because I didn't put all the choices up. One, it could be public, or private, or subsidized, or partially subsidized, and the only choice in which one of the arguments for mandatory is that if you make it mandatory, then you also need to have it subsidized, and that would be one argument for mandatory. One couldn't get the special vaccine programs for children to offer this vaccine unless it was mandatory. But those are possible choices as well.
Yes, Chris. Wouldn't you think that there's a lot of barriers to going to school in the first place, and places that third world countries already stopped making it mandatory? Because a lot of the articles, one of the articles that I read said there's also a stigma around getting the vaccine.
All right, yeah. Let's hold off the developing countries. Once we get through the school issue. Jennifer.
I'm curious. So if it's mandatory, I would think the government would have to pay for it.
Yeah,
Is that typical, or do patients usually pay for like MMR vaccines and that sort of thing? I would think that would be covered by either the government or insurance or something.
Yes, right. No, I'm saying if it's mandatory.
Pay for it.
Yes, right, yeah, right. And in fact, we'll talk about the justice issue that, once the state requires it to be mandatory, you can't, then, what's the point of making it mandatory if you're not going to pay for it?
Right.
Yeah, right, yeah, right. Yes.
I was going to say, like, the school vaccines are mandatory, but the kids, they have to get it to the doctor unless they choose to go to social service. So the ones that go to the doctor have to pay for it. So really, you have to, Yeah. But it's true that,
Yeah, but then you get reimbursed. I mean, keep your private stories out of this conversation. It'll be a long enough conversation as it is if we have to deal with personal stories. Okay. Other, yes, I.
So it will also not include those age groups who have left out school or drop out from the school. The issue of justice will be there.
Well, we're talking about 11 to 13-year-olds, and obviously, there's the home base, but let's, for the purposes of this discussion, I don't think we that's an add-on discussion, okay? We for the purpose of deciding whether it should be voluntary or mandatory, and girls and boys, I don't think we need to deal with that issue right now. Yes,
I
Kathy?
think if you were going to make vaccination mandatory by making it a requirement to go to school, then you're only targeting public school kids, and private school kids wouldn't necessarily be required to have it. So there's a bit of a fairness issue.
Right. So what would be the alternative? So what about now? What do private schools do now about the measles?
I think there might be some private schools, particularly religious affiliated private schools, where a lot of kids are not having that.
Their own state or to be competitive schools, you have to offer it.
Or make notice that it is required.
If it's a religious school, and they accept them, they turn it back in with the exemption, it's fine.
Right, yeah.
But I think in order to be official school, they have to put their paperwork.
Yeah, right, yeah. That, right. So, I think I think we're getting, I think we have a lot of work to do, so why don't I just cross this off, okay? And, because we haven't, it's 20 after 12 and we're still, and good point, I recognize it, but in order to make it mandatory, you have to have some location, right? It could be the schools, it could be the next Harry Potter movie, I don't know, you name it, okay? And in order to make it mandatory, but the concept is, however the state wants to operationalize mandatory vaccination, we'll leave on the back burner. The concept is, should it be mandatory? Okay, so having said that, and then we could cross out the community as well, since we're not looking at the location. So, anyone wants the vaccine is so controversial that it shouldn't even be on the table? Thank you very much. Right. So, you think it should? Just be voluntary and just offer to girls only. Okay.
Oh, but you're asking for a vote?
Yes.
I was commenting on it.
Oh. Okay. All right. Okay. Anybody for this one? This one here. Okay. All right. Okay. Good. So. The less choices we have, the sooner we'll get to keep on hearing this noise. Let me just, okay. I don't know what that's about. Anyway, the sooner we'll get to the, I know you're all chomping at the bit for the developing countries, but anyway, okay. Voluntary girls and boys. Okay, all right. And mandatory, girls and boys? Mandatory? One for mandatory? Two? Okay, good, good. Any other takers? Anyone who doesn't believe in mandatory but wants to debate the merits of mandatory? You know, that's okay. All right, good. Yeah. Anybody else? Okay. And what about? Well, you know, this vaccine is just too, you know, too expensive. So let's just target the high risks. What do you think?
I'm not voting. I'm just saying target them mandatorily or voluntarily.
No, voluntarily. Yes, right. Yeah, right. Voluntarily. Okay. Yeah, right. We can't start building these vaccine mobiles. Okay, going out to the neighborhoods and targeting people. Is that what you had in mind, Chris? Was that your vision?
No, that wasn't my vision.
No. Okay.
But I guess that will fall into that criteria.
Okay, so anybody wants to go for targeting high risk? No, it's not on the table. You guys are just okay. All right, very good. Okay, so very good. So we got these two. All right, so what? Why don't we just have a, you know, for now just a general comment period. What are the arguments for and against voluntary or mandatory? Why voluntary as opposed to mandatory, and what are the arguments for mandatory? Yeah.
Well, I just think that voluntary vaccination is just furthering the disparity between disadvantaged and advantaged groups.
I'm sorry, say that again.
I think that voluntary is like furthering the disparity between disadvantaged and advantaged groups. So I feel that screening pap smears has been effective, and those that are advantaged, they can continue to do that. But if you don't make something for HPV vaccine mandatory, you're forgetting about those people that can't afford to go get the pap smears. So that's why I would say that
you're arguing for mandatory.
Yeah.
You want to do it mandatory, targeting the high risk, and just leave, you know, screening for the involuntary for the what's that?
Just mandatory girls and boys. I don't
Mandatory. That's right. You're one of the people for the mandatory.
Yes.
Right. So you're saying there's a justice issue, okay? And where's that? Where is this coming from? What's that?
Somewhere.
Well, you have a leaky pipe somewhere. I don't know. We're just hearing. Okay. We just. Well, anyway. Just get rid of all this. So let me start bringing up the arguments that these guys were making. Let me just. Okay, let's go. Yeah, okay, good. All right, so we have a justice issue here, and certainly Balak, or however you pronounce his name, I mean, he was concentrating on the justice issue. He was concerned about that unless you, he was concerned, I'll paraphrase what you said, that if it was voluntary, then you would not, individuals, the poor and the disadvantaged, who are in the lower socioeconomic groups are at the greatest risk and would be the hardest to reach with a voluntary program, right? And hence the voluntary program would, at best, preserve the existing disparity and may even increase it, because right now you just have the advantaged people, having access to pediatricians and whatnot, and knowing about the HPV and would get vaccinated, and the disadvantaged would not. So that would be an argument for mandatory. So is that fair?
Yeah.
Okay. Jeannie, do you agree with that, or?
Yeah. I mean, a few of the articles talked about sort of the ethical justification for HPV vaccination. So the reason why I chose the mandatory one, I felt you would be increasing the disparities, but also, I think in that sort of the current situation of vaccines, we have to opt out. That's what I'm sort of envisioning with your mandatory.
Yeah, right. You would opt out with the religious exception. I don't buy this philosophical exception. That's too easy to opt out. But anyway, so.
And I feel like if it was made mandatory, then it would relieve some of the stigmatization that would occur. If my daughter's name Julia, Julia, like Sally's mom decided to get her vaccine for HPV, and I'm thinking, oh, well, Sally's mom thinks she's going to be having, that's really, if it was just a mandatory thing, there wouldn't be that judgment about parents who chose to have their kid vaccine. I felt like that would be relieved a little bit if, it was just sort of everyone was treated equally.
Right. The parents would say, listen, I don't believe in this business, but we have to do it. It's the law. It's like when I talk to patients, and it's like when we talk to patients about advanced directives, we say to patients, well, I'm sorry to bring this up, but it's the law, right? It's always a lot easier to say it's the law, right? Okay, good point. Jennifer?
One of the articles you mentioned too, that with it currently being voluntary, that less than 50% of the girls are actually getting the vaccine. I think 1% of boys are getting the vaccine. So there's just a low amount of people opting in to get the vaccine. So at least if you make it mandatory, you'll have more herd immunity and possible benefits of the vaccine.
Right. So that's a vote for mandatory, right? Okay. So we got I want to just keep track. We got the justice. We got the beneficence, right? But the herd immunity. That's it looks like 0, but whatever. Okay, herd immunity, and the I like your point about the about that. It would be an out for the parents.
That would be my hesitation is that the 11-year-old well child check there is vaccine against HPV.
What's that about? Are you making a commentary on my daughter? Yes.
I just wanted to put support for voluntary. I think
support for voluntary. Okay, go ahead.
So one of the things that Blalog mentioned was the fact that HPV has a low mortality rate, and the fact that when you compare it to other mandated vaccines such as polio, that was the comparison that he put. Polio had a visible and very clear and not a long-term consequence as it is for HPV. And for those who, for women who do get HPV, the deaths that occur from it is such a low percentage. So when you look at a mandatory vaccination that needs to be done, it's kind of hard to justify when you look at the actual disease burden itself. And so I think that would be a reason why you would probably rather make it voluntary rather than mandatory.
Okay, so you're concerned that actually, Blaylock says, whenever you argue for something, he always wanted to bring up counter-arguments, and he brings up the counter-argument that the added value would be modest, and which is true, and he doesn't really deal sufficiently with that counter argument. So how could we deal with that counter argument? Well, why make it mandatory when it's the added value is only going to be modest?
Well, most of the literature on that HPV vaccine is really focused on cervical cancer, which is not the whole.
It's not the whole pie, right?
Whole picture of
Right.
vaginal, vulvar, penile, anal, head and neck cancers, and lots of other things.
And more so in the boys and the genital warts, which is not chopped liver here, right? It's significant stuff, right? So yeah, what do you think about that?
Yeah, and I guess
you don't think that's you only deal in
no, I mean,
death?
for the sake of argument,
Okay.
when you look at even just the history of the way things have been done maybe despite, measles had a higher mortality rate according to the literature, but it's hard to convince, the public that, okay, this is a big enough issue in terms of that, there is, increased mortality, there is a lot of harm where we would make it mandatory. So is it strong enough in terms of the disease burden to say that this is going to be mandatory?
Okay, and now I think that's a valid point, but I mean, we were just talking about all the other cancers and genital warts and a lot of suffering and stuff like that, and so I think all we need is to have a public health advertising campaign and start putting up on like Times Square and other places on the Jones Falls and stuff like that, big ugly pictures of genital warts, okay? And that would mobilize the masses to vote for mandatory, right? That's all we have to do.
I think that your argument is what makes it maybe easier for me anyway to consider mandatory for the developing countries.
What's that? What argument? Oh, the mortality?
Really that huge of a health burden.
You think the argument for developing countries, or developing?
For me, it made it easier to think of mandatory HPV vaccination in developing countries. Yeah, the problem is more severe.
Exactly. It is more severe compared to...
Oh, I see. So this would tip the argument for the developing countries. Okay. Not yet, okay. I feel confident that we will because we got past the school stuff, okay. Jessica.
Hello?
Oh, you're next, okay. Right. Okay. Right now, Jessica is speaking. Go ahead.
So one of the reasons we may not necessarily see the burden of disease for a long time when they're talking getting healthcare and having screening, I know for a long time we covered that Medicaid, I know still is. So you may not necessarily see the burden of here as opposed to, we're not discussing about developing countries, but it like that.
Yeah, right. Well, that would be, I just want to get a sense, okay? How many people would opt for, I mean, I don't want to quiet discussion, but how many people would make it mandatory for developing countries? Okay, all right, okay, good. Okay, hold that thought, okay? We're still not discussing it until we get through this, okay? All right? We've got some work to do. So, Rolla, what did you want to say?
I just want to comment about the issue in developing countries. I tried to do some search to find if there's a real link between the virus infection and cause of mortality. So the death is not directly because of the infection or the cervical cancer development is not a direct cause from the infection of the HPV virus. There are other factors that interfere in the causation of the cancer.
Uh,
So if more evidence was available to just make the snake, then vaccination would be argued to be even better.
but the I think the way to rephrase what you just said is the virus is necessary, but not necessarily sufficient.
Yes.
But if you're getting cancers, cervical cancers, it's most likely it's because you have the virus, right?
But that's only the virus.
Yeah, sure. Not only the virus, yes, right.
So there are other factors, let's say in developing countries, if one separates
so are you saying that we should just, and I think that would be a valid point, that we should just concentrate on the other factors, right?
like hygiene, proper
Right.
eating,
Right. But
lifestyle of the people.
But the problem with that is that I don't think we know sufficiently enough what the other factors are.
Smoking is one.
Well, I don't know. I don't. Well, how many young girls are smoking? No, I'm just kidding. In the developing countries, I know the tobacco company went to the developing countries when we put the kibosh in their operations here. But anyway, it would be nice if we. If studies show that if we concentrated on these other factors, we could get rid of the. We could make inroads in the cancer, but we don't know what these other factors are yet sufficiently enough to say that we could dispense with the vaccination altogether.
Going back to what Yvonne said about not necessarily making it mandatory, a lot of the stuff I read online said that I think, and correct me if I'm wrong, 90% of HPV cases just go away by themselves. There's without any symptoms. And so I think there is some confusion out there because you read that HPV is, the top STD transmitted in the country, but then you hear, well, 90% of them just go away.
Well, I tell you what, how many women die each year in the U.S.? Yeah, we're talking about thousands, okay? And that's just that. As we said before, we got the genital warts and the other cancer to contend with. So I guess what we're going to do after we discuss all these things is that we're going to tease out what are the primary concerns, okay, and then how much weight do we assign each of these concerns? So far, and we've done good work so far. We have. Let me wonder why I put this at the bottom, but that's how we ordered it. So far we have. It's only modest stuff we're talking about, right? So why make it mandatory? And then Blaylock or Blog, whatever, put a vote for justice, all right? And so far only a few people here really resonates with justice. Everybody else here couldn't care less. I guess that's my only interpretation so far, why a lot of you don't care about justice. Just kidding. But anyway, other arguments for and against. Yeah, Jamelia?
Both a lot of us were saying with the rights of the minors, parents are only indirectly, affected by the consequences of HPV. They're not the ones that, if they choose to go and get a vaccine for their child, they're not the ones that are actually going to suffer the consequences.
Right. Okay, good. So rights of the minors. So what does Zimmerman say about that? he talks about autonomy, right? So what does Zimmerman say? What do you want to say about that? All right, we have another contender here for mandatory that, hey, are we doing the minors? I mean, shouldn't we have some paternalism going on here as well? Protect the minors. What do you think about that? Jackie?
I was going to go back to something else and back to over.
You were going to go back to school stuff again?
No, I was going to go back to what you're talking about, the mortality rate being so low.
Right.
Part of the reason is because we have to get treated for it, and what's the cost of that? What is the cost of treating when they already have HPV versus treating that?
Well, yeah, right, but, you know, we don't even want women to get it, right?
Right.
Right, okay, so, right. Okay, so what about the autonomy issue? Yeah.
I think that in general parents have the right to tell their kids what to do, but I still don't think you can make it mandatory if parents wouldn't allow for you to.
You can't make it mandatory? Why not?
Because parents still wouldn't allow for you to vaccinate the kids, especially in places. It just doesn't. There's not an impact in every single community, but it comes to everywhere and say that now we're doing this to everybody.
Why not?
Even all the other vaccines that are mandatory, they don't spread the same way. The virus itself doesn't spread the same way that this one does.
Okay, well,
so you can't.
so is that a, are you saying, it doesn't spread the same way, so why would that be an argument for parental autonomy?
Because based on the perspective of the parent, they won't want to have this as something that's going to be mandatory that the kids will be forced to do, because it's not a problem in so many communities, and especially communities where there's health care and everybody gets their pap smear and everything like that.
Okay, what do people think about that argument? Because it's not a problem in every community, therefore, therefore the concern for the minors, because they'll get their pap smears and stuff like that, is less of a concern. We're talking about the rights of minors to have adequate health care. But you're saying, if I could paraphrase it, you're saying well, in some communities, the minors don't need, any additional.
The very first
yeah, go ahead.
vaccine that is mandated for a disease that spread, especially not through aerosols, just from being around people,
Right.
won't be for a disease. Most likely won't be for a disease that doesn't impact certain populations as much as others, where it's not as much of a problem, because that's just going to be hard to implement.
Okay. All right. So thoughts about that argument? By the way, people could, switch sides. By the way, in order to make a point. Okay. All right. But yes, Ashley.
I kind of disagree with that some, because a lot of the people who are against this are hung up on it because it's sexually transmitted disease.
Yeah.
And, the fear of, oh, these are our kids, they're not having sex. Well, that's not the problem. It's not what they're doing now. It's what they're going to do 10 years, 15 years from now. And the reality is people are going to have sex, and somebody's going to have an HPV, and you might not know it. So it's just, it's to prevent that, and I don't see why what the kids may or may not do 10 or 15 years down the road as an adult has to do with whether or not they should be vaccinated.
Yeah, so you could take, a woman who's had no premarital sex at all and marries some guy who's been running around for years, right? And what's that? Yeah, right. So, you don't want to protect that unsuspecting girl from future morbidity and mortality from that guy who's been running around? Chris?
Yeah, we want to protect that nice young lady from that evil man. But I'm just saying, not everybody's going to be on board with it, and so not everybody's going to feel that way.
Well, you know, I mean, not everybody is going to be on board, but you know, I mean, we got to, you know, we still fluoridate the water as well.
That's different. Nobody's sticking a needle in you to do that.
Okay, right. Oh, so, but where do you want to go with that argument?
I don't know. I'm just saying, like, the story.
By the way, Saturday Night Live had a fake commercial about this. So just Google when you go home, Saturday Night Live and HPV. And they had this commercial. Apparently there's this doll, Little Miss Pound Cake doll, that is armed with 3 needles. And over a few months, the girl will eventually, you know, get a shot, and no big deal. No big deal. You know, oh, Little Miss Pound Cake gave me a shot. So, you know, no big deal. But anyway. So, other thoughts? Jamilian?
I just wanted to say that I do think that it does affect most communities. 90% of people walking around, they have some strain of HPV. They might not have 6, 11, 16, 18, but they do. This is an issue, so it is affecting a lot of communities.
Yeah, right, and the wealthy communities as well. You know, I think I think it's hard to say that you go into the well-to-do communities and it's not a problem. That would be my comeback, Saad.
Again, I would say that the prevalence of cervical cancer is low, and it can be detectable by screening. It's treatable. So making vaccine mandatory will impose too much restrictions on autonomy. Mandatory step will favor, I think, beneficence, non-maleficence, and justice. But the burden of cost on government and parents and the restriction of autonomy, I don't think it will justify to make this decision mandatory.
Okay, comments about that. You said a lot there.
I think it's on point.
What? Good point.
All of them.
Okay, Emily?
The vaccine does not get every single strain.
That's right.
Cancer, so,
That's right.
women will still need to have annual screening.
That's right.
We'll still need to, 30% of women may still be exposed, still need to undergo treatment for cancer. The other issue I have as far as beneficence is efficacy of the vaccine. We're vaccinating 11-year-olds, and you mentioned what happens 10 to 15 years down the line. The vaccine has not been out that long. And when are people going to be exposed? Not when they're 11, not when they're 15, but in their early, mid, late 20s. And is the immunity going to last that long, or are we giving people false security?
Well, it's going to, well, I mean, one, we're doing it at the early age because it has to, the vaccine has to be there before exposure.
But unless you get absolutely everybody who has that complete herd immunity.
What do you mean?
If you don't get absolutely everybody vaccinated, somebody out there is going to have it and pass it on.
Well, you know, what percentage do you need for herd immunity?
30. Maybe also.
First, I wouldn't shy away.
I think it depends on the body.
Yeah, well, I mean, estimates have been, don't exactly, I mean, the modeling, there's been several modeling studies, and it's somewhere between, 30 to 70%, and you need the boys too, by the way, and the But if you don't need 100% for the herd immunity, so your point was what again? I'm sorry. The
Just in terms of protecting, is this vaccine creating a false sense of protection?
all sense of protection. Well,
And also,
yeah,
because
right.
you have that 30% that are going to be infected with strains that are not covered by vaccine, you are not eliminating the need for continued screening.
That's right.
Continued treatment.
That's right. In fact, that's the argument that Zimmerman makes when he talks about non-maleficence, that he's concerned about, he mentioned that you get the vaccine, and that means you could, sleep around without protection and stuff like that, and there's other STDs, and then you won't get the screening. But actually, there was one article I just downloaded this morning, which and I'll post it, where it showed that I think it was just focusing on women, where women who had the vaccine were more likely, compared to women who did not have the vaccine, to practice safer sex. More likely. And when you think about it, that might make sense, because if you're, somehow motivated to get the vaccine and knew about it and stuff like that, maybe it's because you're more, I don't know, in tune with the times, or more concerned about sexual health and stuff like that. The argument about that people who would get the vaccine would be off guard is really a fiction. Could be a fiction. We're just, throwing these arguments out the wazoo. Now, to be sure, I mean, it's nice to raise the argument, and now we're getting data, which is good. But I'm just saying that sometimes these things are opposite of what you think it might be. Jessica?
I'm not sure, but one of the articles talked about the hepatitis B vaccine.
Oh yeah, the hepatitis B vaccine. Yeah, let's put that on the table. Thank you very much. Yes.
People getting that vaccine didn't necessarily give them the path to just go and do anything sexually.
Yes, right.
They kind of parallel the hepatitis B vaccine. Right. That there are differences, but...
Yeah, what are the differences? Are the differences significant enough? I mean, we're giving kids the, injection, Chris, injection for the hepatitis B, and what's up with that? That's pretty much mandatory, right? What's that?
Yeah.
Yeah, right. And so how come, is there a disparity here, or in congruity here? We're giving the hepatitis B 3 shots to our infants, okay? And so why not the HPV? Scott?
Because I think HPV can be transmitted by other routes as well.
By what?
By other routes as well, other than sexual transmission. It can be transmitted by through blood. It can be transmitted through blood, and HPV.
I'm sorry.
It can be transmitted through IV needles.
Right. Yeah. So
Needle stick injury, and it is more deadly cancer than cervical cancer. It is associated with more complications.
more deadly?
Yeah.
I don't know. What do you think about that statement?
There's a higher prevalence.
What's that?
There's a higher prevalence.
Of what?
Hepatitis B.
Right, yeah, but, well, that gets to this, so is that the reason, that might be the reason, but I'm just asking, is that the reason why, we're so, fast to do the, hepatitis B and not the HPV, Nikki?
There's no screening
Right,
method.
but from other data that I saw, the protection from HPV vaccine so far it's about 5 years. There's no data to show that it protects beyond 5 years.
Yeah, well, that's the point Emily was trying to make. Sure,
that's
sure.
the thing.
Okay.
Then the other thing is there's no proof that it will protect, will give a lifetime.
That's right.
No data that will
No, you get a booster
protect.
shot.
Yeah.
You get a booster shot.
Okay.
Yeah, no big deal, but what about the precautionary principle? You're going to wait 15 years for the data?
No, but I'm just saying.
Oh, you could have said yes. That would have been fine. I would have accepted that, but now I see you're backing away, so you're not holding on to your arguments. That's fine, no problem. Okay. So, all right, well, I don't know. Again, okay, so you want to say that vaccination against hepatitis B, the reason why we do that is because of there's more morbidity and mortality with hepatitis B. What do you
I
think?
mean, I just feel like in the world of public health, even if there's only 4,000 people dying of this HPV every year, it's still our job to try to eliminate that. So if there's a possibility that with this HPV vaccine, the combination of the vaccine plus screening, we'll really never know unless we try to combine those two. Maybe if 4,000 will change into 2,000. You never know. But we continue to, the percentage of people that are actually getting the vaccine every year is just low. So we'll really never know.
Right, and again, I would put on the table, don't forget the warts, okay?
Yeah.
And the other cancers, okay? That's not insignificant. Right, Jeannie.
I was checking on one quote, I think with regards to the boys, and that one guy who said, we have something that we know will prevent cancer, and that was like the dream of our youth or something.
Yeah, right, I remember that too, yeah.
So that sort of, struck me as, think of it that way.
Yeah, that's a good deal.
So still focusing on this rights of minors, I unfortunately don't buy the argument about well-to-do communities, and now Zimmerman puts a lot of capital on parental autonomy. Is there sometimes, I mean, we need to argue by analogy. Is there any other situation in which we tell parents we got to do something for the health of your child, regardless of your exception? Cassie?
Well, I don't have a direct answer to that, but I think that there's been a lot of discussion about parental autonomy, and I'm not sure that it's really that relevant given the health issue that we're discussing.
Yes, right.
It's a sexually transmitted infection. When it comes to reproductive health of adolescents, parents aren't necessarily involved between the adolescent and the clinician. If an adolescent seeks prescription for birth control or treatment of a sexually transmitted infection, or is pregnant and wants to get an abortion, the clinician is not required, or
That's right.
They're not to contact the parent. The parent doesn't have to be involved or give permission for something like that. So I don't see why this is so different from those clinical practices.
Right, yeah. Ed?
In response to your question,
Yes?
I would say the car seat laws is an example of forcing parents to comply with certain ways of taking care of their children in cars. You can't just throw them in the back seat, go. There's a lot of rules and regulations.
And certainly with the car seats, rear facing, stuff like that, how many pounds and all that, but but there's a much more stronger situation in terms of Jehovah's Witness. If a child comes in with trauma or whatever and needs blood, and the parent says no, religion exception, and we say sorry, we have to give the child some blood, overriding parental autonomy, even with a religious exception. We override parental autonomy for the health of the child. Now, I'm not sure any arguments, and I'd be willing to walk on the coals for this, but if you want me to, but I'm not sure that, any argument about, well, this is down the road type of morbidity as opposed to something that's immediate. I mean, that's the one of the alleged differences between polio and HPV. But and the mere fact that you could get cancer down the road should be held in the same degree as catching you name your contagious disease. So we do override parental autonomy sometimes for the rights of the minors. Yes.
I was just going to say, I was agreeing with you on the immediacy. I mean, you can get a more visceral reaction to it, and people can buy in more, but ethically I agree that it probably doesn't have any particular distinction.
Yeah, right. It's a very important visual distinction, but not a moral distinction. Not in my books, at least. So what else? So any other? I think so. The HPV analogy, Zimmerman brings it up. I don't buy. I personally don't buy. I mean, he tries to wash it away, saying something about kids could get. I don't know. He made some statement. Kids could get HPV in the classroom. He said something like that.
I think I remember that. I think it was a discussion of the fact that like HPV is transmitted because of behavior versus other.
In the classroom.
Right.
Yeah. I don't know what kind of behavior is he talking about.
I think it's opposite of what you're saying. Like HPV is because of behaviors, but the other diseases that we have vaccinations for, like you can get them just by sitting in the classroom.
Oh yeah, no. He says here. Furthermore, studies have shown HPV can be transmitted between preschool-age children.
HPV?
Yeah, HPV. What's that?
You can have blood and saliva.
Yeah.
That is very true.
And I guess preschool children are exchanging saliva. Yeah, I guess that's true.
It can be household. You can have household transmission of toothbrushes.
Oh, okay. All right. Okay. All right. Okay. All right.
Not the kind of place.
Right. Yeah.
Like being at school and just kids like having cups like at snack time and just picking up the wrong cup and drinking out of the cup.
Oh, okay. All right. Okay, that makes sense. Now, again, now is that the rationale for giving infants the hepatitis B vaccine?
No, I think the issue is that for the HPV vaccine, I think the people who are infected, the kids who are infected with it, 25% of them will die before they even, I guess, hit the age of what we're asking people to be vaccinated for HPV.
Yeah, well, it sounds like the same thing for HPV, right? We want to prevent morbidity, mortality down the road type of thing, right?
But I think with
the sooner they get it, the better, right?
But I think with HPV, like mortality is...
When HPV?
Yeah. Mortality is at a younger age versus HPV.
So is that a moral difference to make a different vaccination policy?
Yeah, making it mandatory versus voluntary.
Well, no. But there has to be a difference between hepatitis B and HPV. I mean, hepatitis B is essentially mandatory. So I'm saying what you just said, is that a significant moral difference not to have HPV on the same plane as hepatitis B? You're saying yes. Okay. Response to that? What do you think? Chris?
Yeah, I was gonna say I agree because, like for in children, like I was a baby when I got the
I'm sure you were.
when I got the hepatitis, so therefore I'm not aware of the fact that maybe I can go out and whatever you do to get hepatitis, but in a child, you know what I'm saying? It's a little bit different. Like man, I'm Superman after this, you know. It's a possibility.
Yeah, but I just showed you data that the people who got the HPV were more likely to have safer sex practices than those people who did not.
True, but they're still aware, and I'm pretty sure it didn't say 100% of them were less likely to.
So what does this awareness have to do with anything?
You're aware of your own immunity to
Yeah.
HPV,
Right. Okay.
which may arguably encourage different kind of sexual behavior.
Yeah, but I just showed you data, albeit one study that shows that people.
What's the end of that study? How many people were in it? Who were they? Where were they at?
If you were in science class in middle school and you learned about hepatitis B, you knew that you had vaccinated for it. That doesn't change your, becoming aware is not going to change your behavior.
I think the key thing is exposure. I think with children, when it comes to hepatitis B, if they were exposed to that virus, children knowing that they're still developing their immunity, I think the disease progression and morbidity is much higher, like once you're 5 and below. As compared to HPV, the chances you being exposed to, HPV is going to be much later when you are sexually active. But for hepatitis B, the mode of transmission can happen to a young child, and it makes
And that's why we give it that infant time, right?
Yeah, and I think that's where the difference lies, and probably the reason why it's important to get the vaccination to an infant for hepatitis C early.
I don't think anyone is saying infants should get HPV when they're 3 months. You're saying that?
Yeah, because I think giving the vaccination, the purpose of giving some of the vaccination in early childhood is because of the issue of compliance, because the baby are born in the hospital and they can be easily for the first 6 months.
Yeah, I don't think anyone is arguing against giving infants the hepatitis B. All I'm trying to say is that we make that mandatory, okay? Why not HPV? What's the difference? And let's not focus on the timing issue. I'm just focusing on the mandatory issue. What's the difference between the two? Why do we make one mandatory and the other not? Jessica.
Like the time frame shouldn't be, pivotal factor.
Yeah, that's right. I agree with you. Yeah, right.
HPV vaccine is recommended for 11 to 12-year-old girls. And the trend now is that young men and young women are having sex at an earlier age. I think one article said by 12th grade, 50% of the kids already had sexual intercourse.
Yeah, that's right. And that's why we picked 11 to 12. If kids were having sexual activity at 5, we would, bring back the timeline, right? What's that?
Kids are not having sex in preschool, so they're recommending it for an age 11 to 12 where they know that.
That's right. That's why we're taking 11 to 12.
Kids are
Yeah.
having sex.
Right. So it makes sense. We give the hepatitis B at infant time, no problem. And it also makes sense we give it at age 11 to 12. The HPV. All I'm saying is that I personally think, okay, the HPV analogy works for HPV. Zimmerman, blows it away, and I don't think he makes enough argument not to blow it away. Now, he also says that a big difference is the difference between the state mandates for routine childhood vaccines. And he tries to make a difference between that and the HPV. And again, maybe somebody else wants to make a more convincing argument that I didn't. I mean, here he goes into you know the for these, you know, you could cough on someone and get someone infected as opposed to sexual activity, and he makes an argument based on that. But I personally don't buy that as a significant enough difference to say that you don't need HPV to be mandatory. Yes.
The better question is whether or not there's a lot of controversy around every vaccine every time it is initially put out there. Like, if you go back to whenever hepatitis B vaccine came out, was there controversy around that?
Yeah, you know, that's a good question, and I just don't know. I just don't know. Now, to be sure, when the HPV came out, I think there was probably, well, I don't know if the country was vaccine tired, or you know, we were so worried about autism, and then you know you have people like Michelle, what's her name, Bachmann, saying you know those crazy things, and then Terry, yeah, you know, we do it in Texas type of mentality. It was probably the initial effort was to do mandatory, and it was probably it had a negative fallout in the sense that it was probably pushed too soon for mandatory, especially with a new vaccine, and also we didn't have a lot of data, you know, what 2006 about the safety and stuff like that, and so it was a wrong move at that time, and now just and we're still for the mandatory people, we're still having to overcome that negative reaction. But now we're getting more and more data that's dispelling the you know the false safety. You get the vaccine, stuff like that. Zimmerman talks about the principle of double effect. I don't know why he does that, but he says it's an argument for mandatory. He talks about utilitarianism, and he says you know, he says that's a great argument, utilitarianism. But then what does he say? As to you know, he poo-poos this great argument for utilitarianism, and he brings it up, a counter argument, and then he says, you know, it's no good. Anybody remember what he says? Mm-hmm. All he says was utilitarianism is not a good theory. You know, it's, I mean, I'm not sure if that's a good argument against utilitarianism, that our country doesn't buy into utilitarianism, so I don't understand that counter-argument. Jennifer?
I had a question, maybe you knew, because he compared it to some of the arguments from the trials with the Nazis, that they used a utilitarianism.
Oh, yeah, right, yeah.
I didn't quite understand.
Well, you know, utilitarianism is a theory of the where the majority is right. Majority rules, and in Nazi Germany, you know, the majority thought, you know, Jews and other people were, you know, yeah, right. So, utilitarianism is not a theory for minority rights, okay, and no doubt about it. But then again, you know, that's why, you know, in the U.S. we have basically a majoritarian government, right? But that's why we have the Supreme Court to protect the minorities. When, yeah, I mean, Blaylock, you know, there's also this that goes on, links to this. So after we've said, after we've squashed through all this, and you all made a lot of good points. So what are the major points for voluntary, and what's the major point, if you have to sum it up before we go on to the developing world, okay, before we take our arguments and transport it to the developing world, what are the major points for mandatory? What resonates with you most? And what are the major points for voluntary? Ed?
Say with mandatory, what strikes me most is the argument for justice.
Argument for justice. Okay. All right. So, I don't know. Okay. So we got the major point is for justice. Okay. Any other major points? Todd, you have another point for mandatory?
I will say herd immunity, beneficence, non-maleficence, and
Wait a minute. This is for mandatory.
yes,
Just pick one.
I will say herd immunity.
Herd. Where is that? Oh, here it is. I knew it would haunt me. Herd immunity, of course. All right, Rolla, did you want to say something?
No, it's okay.
Oh, it's okay. All right. Any other major points for mandatory? We argue for, your best foot forward for mandatory. We got justice and herd immunity. In fact, herd immunity is linked to justice, right, in a way that in order to capture, and I say that word in a nice way, in order to bring in the disadvantaged people who won't have access to the vaccine for whatever reason, and there's plenty of that, you have to, in order to protect them, if they can't get vaccinated, even with the mandatory, all right, you depend on herd immunity to provide beneficence for them as well. So herd immunity and justice are really linked as well. Yes?
I have a question regarding the child vaccine program. Are the vaccines in that program are all mandatory, or they can be voluntary as well?
Those programs are paying for the vaccines. So I don't think they have anything to do, I mean, to be sure I'm the last person to answer about that, but I appreciate you asking me. But I don't have a problem dealing with uncertainty here. But I don't think they're involved with it being mandatory in that. I think those are programs to pay for the vaccine. But, okay, the mandatory people have thrown down their best foot forward, justice, okay, and herd immunity. Those people who advocating for voluntary, what's your major argument?
Low cost effectiveness. Too much burden on the government.
What's that? You don't.
Too much cost burden on the government.
So you're saying it's, yeah, we haven't really talked about that. So you're saying it's not cost effective. Okay. And now arguments, that's on the table. Arguments against that? Oh, well, no. Before I want the voluntary people to put their best foot forward. Anything else besides cost effectiveness? It's Yvonne?
I mean, what I said earlier about the mortality rate, I guess the lower disease burden.
Oh, okay, the lower disease burden. I should have brought my picture of the warts, but anyway, I'm bringing this up, and I don't know how I could convince you. Anybody who wants to post a picture of a wart, okay, will get extra credit, okay, all right, and super extra credit. don't personalize it now. Now, super extra credit if you send it directly to Yvonne. Okay. All right. Okay. So,
Oh my.
all right. So, added value would be modest. And, well, I guess, look at this. So this is really tied into this, right? In a way, right? So, any other best foot forward for Yvonne? Is this your best argument, cost effectiveness? And, Chris?
Also like Zimmerman's HPV,
This analogy.
this analogy.
This analogy.
Because I just don't think what happens to somebody while they're unconscious can be compared to what happens to somebody while they are conscious. Ultimately. Or unaware. Unaware is a better term. You can't if I'm a baby, I'm unaware of what's going on. If I'm 11 to 12, 9, 13, then I am aware of what's going on. You can't compare,
Awareness and...
Yeah, you can't compare what you can. So you're saying that you mandate this for infants, which is different from mandating it to the infants who are unaware.
No doubt about it. There's a difference. I'm just not sure there's a moral difference between that.
And the principle is the same with parental duty to protect child.
Yeah, right. I mean, again, the reason why we get it at infants, for reasons previously explained, but I'm not sure if awareness is a...
I don't know how Zimmerman phrased it, but...
yeah, well, I don't know either, and I've read it several times, and I still don't buy it. Oh, okay, well, we'll give it a little bit there. Okay, so...
What are you going to do?
Yeah.
I think autonomy is a big argument for
voluntary autonomy? Parental autonomy.
Yeah,
Parental autonomy.
the best way to
Okay, so you want to bring that in the... I can't... yeah, okay, you want to bring that back. Okay, all right. So autonomy. Oh, well, I'm sorry. Get that. Let's keep it green. I like playing around with this toy, so bear with me. All right. So there you have it. So we've analyzed the heck out of this, and argument against cost effectiveness. Yes.
I read one article and it said that one of the doctors in the article said that just looking at the war in Afghanistan, like 3 hours.
Yeah, 3 hours and you got your money.
Right.
Right, and we're pulling the truth out, right? So we're going to have the money.
Right. So it's about 70 already, so maybe the money is there.
Right, yeah, so now, one article talked about cost effectiveness for assuming you're only vaccinating girls. That was before you realized that in order to have a good defense against sexual activity, that you need the boys too. Actually, if you're just talking about the girls, it is cost effective. Something like $50,000 for life saved, which is par for the course for something that's cost effective in our health care, $50,000 per life saved. I happen to think that my life is worth more than $50,000, but that's how U.S. society. And I don't know what the figures are if you throw in the boys, and when we get to developing countries, which we will in 30 seconds, if you let me, the price is going to go down, okay? It's going to go down. I'm not sure, there's a lot of assumptions with the cost effectiveness analysis. Jennifer.
And just,
yes, right, summarize,
it's
okay.
4,000 deaths, that's not something
that's not,
4,000 deaths,
yeah.
genital warts for your whole life, so how do you really...
Yeah. Turn around and talk to Yvonne and talk about the war.
I think I'll get a bunch of emails.
All right, okay.
We're in the hospital right now with metastatic cervical cancer, and I'm sure that she would much rather have a $300 surgery shot than die from cervical cancer.
Right, yeah, okay. All right, okay, good. So and now it all depends, now that we have isolated the major arguments, okay, we got autonomy and cost effectiveness, and the added value would be modest, okay? You got to put some weights on those, and now you got to compare it to, justice. So now that we got, rid of all this other extraneous stuff that just bogs us down in the argument, now it all depends on our values, how we weigh cost effectiveness and modesty, whatever, against justice, which has more capital, okay, and different people will weigh in differently. So, having talked about that, you're all chomping at the bit. So, developing countries. So, again, it appears that a lot of you are saying mandatory for developing countries. So, what people who are the voluntary types, okay, and I know who you are, okay, and so, why don't you just pass this around and just put down whether you're an M or a B. No, I'm just kidding. So I can make a notation. People who are the voluntary type, and if you switch to mandatory, what was it for you that made the switch?
I think for me it was the government infrastructure, lack of infrastructure like mentioned in the articles. There's no preventative health care.
For the screening and
right.
stuff like that.
So with that, I think a mandatory program would reach a lot more high-risk individuals who aren't able to get doctors and their programs.
All right, so here, I guess the added value would be much better, right? Is that what you're saying?
Yeah.
This and probably would increase the cost effectiveness, right? So that made the switch for you. Okay, yes.
I think I'm more on the voluntary side.
Oh, yes, right. I actually read your post this morning, right?
Yeah.
Explain that to me. Go ahead.
Yeah, making it mandatory, to me, is not feasible. Even if you force them, because I mean, developed countries have other healthcare competing. They have other resources that they are competing for. So, and besides, I think
it's just too much money.
Yeah, the budget now, because I think it's up to between $10 to $25. And I know Gavi is working on it during the price now.
Yeah,
it's still very expensive. So if you're going to put a lot of pressure on the government to select which program, granted it's very good, but if you make it voluntary with a very cost-effective education, then I think rather than making the money, because some people also have a stress for government. So making it mandatory, they probably think, oh yeah, you try to decrease fertility among young children or whatever. So to me, it's not.
What's the thing about the young children again?
If they have mistrust for the government and the government tries to make it mandatory, then most people wouldn't have their young females vaccinated.
So you're saying it's not a good move for the government to make it mandatory, to make everything else mandatory. What's up with this?
Yeah.
Right? Yvonne, you had your hand up first.
Kind of on the, I'm
not ignoring you just because you don't believe in genital warfare. I still recognize you.
I never said I didn't believe in genital warfare.
No, I'm sorry. I'm overemphasizing.
Yeah. Well, anyways.
By the way, everything we say here is confidential, right? Okay. Don't let, pun intended, don't let anything go viral here. Go ahead.
Well, just to support a little bit of what he's saying, but my issue particularly, I'm kind of on the fence in terms of mandatory and voluntary for the developing world. And I think each country is a case-by-case aspect, and I think it's
absolutely.
Yeah, and I think that it's important that we do understand the cost effectiveness of implementing the mandatory vaccine. I know where the burden is much heavier is in Southeast Asia and in Africa, and Rwanda is the only country in Africa that just recently started putting, I think they have a mandatory vaccination program, but it's all because of donor funds that they have. The government is not able to pay for it.
Yeah, right.
Secondly, I think that when we look, it's not even necessarily about the fact that countries don't have screening programs or they don't, have preventative measures. A lot of times they do exist, but when you look at people who don't have access to care, that's where the issue becomes. When a lot of countries where you see women who don't even present themselves when they're pregnant or they give home birth, they don't see it necessary to probably go to the hospital, for instance. So if there is a mandatory vaccination program, are those people still going to be accessible to it? And, that's where the justice issue can come into play. So I think you have to look at it comprehensively, look at the infrastructure, and look at the government programs. So it's a case-by-case issue for me.
Yeah, absolutely. Country by country. You have, some countries who, are very leery about, foreign pharmaceutical companies vaccinating. Look at what's happening in Pakistan. The health workers who are administering the vaccines. I forgot the polio, right? Yeah, they're getting shot. It's just crazy. Karina, you want to?
When I was reading into it, over in globally there's like 500,000 deaths from cervical cancer. I know there's other cancers, but just on that.
Yeah, go ahead. Yeah.
So thinking about as you said also, in different costs and how much resources and time should be put into this. I'm not minimizing that 500,000 people are dying from it, but at the same time, there's other really easily preventable diseases that I think it would make more sense to mandate the government to do something about them instead of cervical cancer or HPV.
Hepatitis B.
What's that?
Like hepatitis B and HIV.
Well, it's there are other competitors, I'm not aware of a vaccine for HIV yet, but surely, the question is, if you devote funds to HPV, would that steal away funds from HIV treatment? The answer might be yes, but until you start, the money issue is very important. Who's going to pay for it? But you're not going to get anyone to pay for it until you start lobbying for it, and be the first in line, to get the funds. And then one article was someone. I forgot who posted the article. It was a 2-page thing, HPV Beyond the Rich World. To be sure, the funding issue is important, but there's and sometimes you need the indigenous pharmaceutical companies to start making the drug themselves. And there's a hope for $1 a dose, but a lot of indigenous companies are afraid to do it because of the patent issues. So that shouldn't be a big enough issue. The patent story is a broad story in and of itself. Syed?
Yes. Like you mentioned about before, I think I was reading on World Cancer Day this year, they're going to take the HPV vaccination through, donations and go to these developing countries to start some type of pilot vaccination program, like Kenya, a few.
Oh, okay. All right.
I think they are going to start some type of initiative.
Right, yeah. So if you say, we just don't, we're never going to have the money, it starts to be a self-fulfilling prophecy. Unless you start fighting for it, yeah.
I would argue the same thing. We eradicated smallpox. There was a worldwide effort to get the vaccine around, and we eradicated it. So it's not, it may be difficult, but it's not impossible to get these things together.
Yes, right, yeah. So The added value, that's not there anymore. I mean, and the cost effectiveness, you just bring down the price, right? So you knock that out. I mean, just, you know, global justice, right? So what would be the, Frederick, I thought you had a, well, the argument against mandatory would be a concern against international companies providing the vaccines and the trust of the people in such vaccines. I don't, and I'm sure that's country to country. I'm not sure, and to be sure, you know, the where do you put your resources in, but I don't think anyone will say this is a insignificant problem, and something that if you could get, you know, funders for it, then the more power to it. So I think any arguments against mandatory, I guess there's the trust issue. I guess in some countries the citizens just don't trust anything that's mandatory, right? I guess so. Yeah, you think?
Yeah, just to piggyback on what Frederick said, not just the trust issue or who's going to pay for it, there's also this issue about cultural beliefs and taboo about, you know, doing stuff in line with, you know, sexual education or sex education. Some cultures believe that introducing vaccines means you're giving the kids permission to, you know, flirt or be promiscuous.
Yeah, right, but maybe not.
Yes.
In fact, if anything, is the argument right that in the some societies, a lot of women have a problem getting pap smears.
Yeah.
Right?
That's where I'm getting to too.
Oh, okay. I'm sorry.
All those,
Yeah, no, but that would be for the vaccine, because that's why pap smears don't work. Because women would rather get the shot. If it's mandatory, you could use, you know, the government is making me get this at 11, 12, 13, and obviously I haven't had sex yet, but women in some developing countries, if, you know, before they get married, would be embarrassed to get pap smears because of the concern that they're announcing, you know, their sexual activity.
even the married ones still have a problem with someone examining their
Absolutely right. So you're making an argument for the mandatory. Thank you. Right? Right. Thank you very much. She came over from the dark side. Okay. All right. I knew we would capture you. Okay. All right.
You're making an argument.
I'll try to
Yes, yes.
Yeah, no, that's what I thought too, but yeah, we'll take her on our side.
Yeah, I was just presenting like different things that might play a role into whether or not the mandate, whether or not mandating the vaccine will even work in the first place. Well, there are so many barriers. Say you introduce it to a country where they don't have constant supply of electricity. Here, we don't know what our law says about you live in a country where there's no power for a month. And then the vaccine is supposed to be sitting there, all the money is sinking. Some people don't have access to how they're going to get to the clinic in the first place.
Yes, right, yeah.
Go to school, you say you have to get it, the mother says, listen, you stay home, you're not getting that shot. And then you don't
It could be, and that's why it's country to country, no doubt about it.
Going back to what Kim said about the potential barriers, the Cervical Cancer Coalition did a study where they tried to message these vaccinations in a different way, and they found that so many people around the world were just so uneducated about HPV. They thought it was HIV. They're all STD. They thought when you said I'm giving you a vaccination for STD prevention, they wouldn't do it. But when you said a cancer prevention treatment, they were okay with it. So I think that's one barrier that's worldwide, just a lot of stigma and a lack of education.
Yeah, right. Well, I mean, in this country too. So, what was I going to say? So, nobody One other argument made is one ethical test is that let's do voluntary first and see how that works. Thinking about the least intrusive means test. So let's do voluntary first before we do mandatory. What do you think about that argument? Does that hold any water, Chris?
I mean, I think that's not cost effective.
What's not cost effective?
To try to do both and then you...
No, not both. You do voluntary first. Let's see how that works.
Yeah, and then even the evaluation process would be very... it take a lot of time and it costs a lot of money. But the reason why I had wrote that is because...
I wasn't coming from you. I mean...
Oh, well, I wrote something similar. The reason why I said it is because I thought that it...
You wrote something similar?
Yeah, like we should do a program evaluation.
Okay. All right, go ahead.
That we should do a program evaluation, see how that works, because based on what everybody's saying, mandatory wouldn't be that great of an option with all the pushback. Like, mandatory also would arguably be ineffective based on how the communities in the different countries would react to being forced.
Yeah, there's no doubt about it. And in fact, on our little framework, just can't find it. Oh, yeah, there it is, right? I mean, on the bottom it says, it's left off the page. It used to be on the bottom, community acceptance, feasibility, no doubt about it, okay? You gotta get the community to buy into it, because ultimately you don't want to lose trust, and that was the problem with the early efforts to make it mandatory here in this country. I mean, it's unfortunately linked with sexual activity, and we have a lot of Puritan values and stuff like that, so it's not going to work. Anyway, it's just the I mean, the problem with the voluntary approach first, in this headline, HPV-associated cancers are rising. HPV vaccination rates still too low, new national support says. That's January 2018. So, I mean, the rates of vaccination here in the U.S. is about 30%. Canada is like 85%. And the UK is 60%. Our rates of vaccination are very low, so, voluntary is just not working for whatever reason. And then here, this news report, more preteens get vaccines when schools require them. The school is most kids go to school, so it just makes sense that whatever program you're going to have, voluntary and mandatory, that's where you get the message out. Anything else? I think so as you can see that a lot of stuff that goes on, and your job is to listen to the arguments for and against it, and see which facts hold are more convincing. With the data, a lot of the arguments that women make, I don't think holds water. I think Blaylock, he makes good arguments, but sometimes he puts things on the table as well, and he doesn't address it when he brings up again the counter argument that it would be modest. But I think his best argument is the justice, and Zimmerman is the I think he makes the argument for cost effectiveness. He does make he says nothing about justice. He does mention justice, and it's in the realm of talking about something about college women being able to refuse it or not having had it before. Or, it's a very I mean, for sure, he didn't consider at all anything about the disadvantaged folks in the U.S., so which was a major flaw in his argument. And Blaylock then attacked more the issue about the added value of the modest. So again, any final comments on this? This is a good. I'm always concerned whether HPV is still relevant to talk about. I don't know why I said that word, but I don't actually. Any final parting shots? I think this is a good example of how one could bring in all the different issues in a vaccination or or any public health care practice to not only to prevent harm to others, right, but also protecting the self. So again, it's also a mix of paternalism. In this case, it would be soft paternalism because you're doing the minors. Yeah. Nakeem, last word?
I was going to say that I would have loved to hear the argument about if HPV vaccine meets the requirements for non-taking.
I'm sorry?
I said I would have loved to hear an argument whether or not HPV vaccine meets the requirements for non-taking vaccination.
Well, what other requirements for mandatory?
I know one of them is that it has to be safe. They have to fulfill the public health requirement. For public health goals for protection against, protecting the public. And the other one is,
what are you looking at? What the heck is that? It's there? Yeah. Well, and what sort is that from, pray tell?
No, it's one of the...
Is that from my hand today?
No.
Thank goodness for that.
Yeah.
No. Well, I think it's, there's no public health goal here, right? I think there is. And to be safe, to be sure, that was a big concern in 2006, but we're getting more and more data, and it's still on the table, no doubt about it, okay? But surely we're not going to wait 15 years to start vaccinating. That's always a concern with vaccinations, the extent of safety. We now know, contrary to Michelle Bachmann, it does not cause mental retardation, okay? So thank goodness for that. But I think it holds the, well, as you can see, I don't know what's exactly in that paper, but we got to weigh all these issues, for it and against it. We got, non-maleficence, it has to be safe, and all this other stuff, okay? And we have to decide which ones are, at the end of the class period, at the end of the day, we have to decide which ones are the weightier issues, and we did that. And then we have to decide, once we isolate the weightier issues, which holds the most weight. And that's going to depend on our values and what we think is more significant in how we do it. So, so it's the framework. Okay, so next week we'll talk about obesity. and we'll see how we handle that. Okay. All right, good. Have a good week.